This video has been created to prototype the current state processes and protocols at Christiana Care Health Systems in Delaware. Christiana receives approximately 80 to 95,000 patients every year and is the only Level 1 trauma center in the tri-state area. Our prototype will feature 3 cases each to varying degrees of prioritization in trauma. 3 cases will be kidney failure due to dehydration, diabetic kidney failure, and trauma code Victor. Maria arrives with her friend in an ambulance and is feeling ill. Paramedics transfer her to the ER amongst nurses and ER physician's assistants.
We believe Maria is a young student at the University of Delaware who has been drinking at the Firefly Festival in town, which is where we picked her up. Since retrieving her from the festival grounds, we've noticed she's heavily intoxicated, consistently vomiting, and tachycardic. We suspect she's severely dehydrated.
Maria is transferred from the ambulance stretcher to the ER stretcher and taken into the building. Maria is taken to an open ER bed where PAs, nurses, and doctors assess her condition, and she is hooked up to the IV and ER monitor.
Hi Maria, we realize you're feeling ill and we're here to help. We're going to hook you to some fluids and get you going on some meds that should relieve some discomfort, okay? We're also going to do a quick head-to-toe physical exam, alright?
The medical team begins completing a physical exam, including analyzing her respiratory functions, cognitive ability, cardiac status, GI state, mobility, and more. Maria's labs are taken, including a blood test from the IV stick. Doctors feel Maria's stomach and ask her friend some questions.
Has she been drinking any fluids? Has she been eating at all? Is she on any medications?
Well, we've been at the festival all day drinking, and I don't think she's eaten much today. I don't know if she's on any meds, but I know she doesn't have any chronic conditions, if that's what you mean.
Amongst the assessment, the nurse notices that Maria's skin turgor is delayed, a classic sign of dehydration.
It's looking like she's severely dehydrated. Maria, I'm going to take your blood pressure to see how your blood flow is, okay? I'm going to need you to move around a bit for me.
The nurse continues to take Maria's blood pressure, lying down, sitting up, and standing. A nurse comes into Maria's room and explains to Maria that her creatinine levels are very high with elevated hemoglobin, signifying kidney injury as a result of dehydration.
Her creatine levels are high, which tells us that her kidneys are failing due to severe dehydration. We're going to keep pushing fluids and see how she responds. Maria, we're giving you antiemetics for your vomiting and pushing more saline to ensure your sodium levels are stable and that you're receiving the fluids you need to recover. If you're experiencing any pain, let us know and we will give you some Tylenol to help, okay?
Maria stays in the hospital as she's observed by her medical team. An hour later, the nurse comes back in and checks on Maria.
Maria, we've updated your blood work and vitals. You're responding well to the fluids we've been giving you, and it's looking like your kidney function is stabilizing. We'll be back to check on you soon, but you should be out of here in the next 1 to 2 hours. If you need anything, let us know.
An hour later, the PA checks in with Maria. After receiving fluids, she is sober and recovering.
Maria, how are you?
Feeling much better.
That's what we want to hear. Your vitals have stabilized, and your kidney is on the road to recovery, which means you're able to go home. At home, be sure to only eat as much as you can tolerate. It's good to eat things like simple noodle soups. The sodium in the broth will help to make you thirsty and cause you to drink more fluids and stay hydrated, which is what we're after. Lastly, Maria, follow up with your family doctor in a couple days, or you can set up a chat with one of our clinical doctors at the hospital. Does that sound good?
It does. Thank you for everything.
Maria is now free to go home and begin recovery outside of the ER. Julie arrives at the ER in an ambulance. She is experiencing severe shortness of breath. On the way to the hospital, Julie mentioned to the paramedics that she is diabetic. Paramedics recite Julie's vital status to nurses and PAs as she is transferred from the ambulance stretcher to the ER stretcher in the ambulance bay. Medics check her EKG and blood sugar levels to understand her condition.
Julie, we're going to have to do a full body exam, okay? If you're uncomfortable at any point, please let us know. We're also going to quickly get some labs done so we can get some results back as fast as possible.
Julie's labs are taken, including a blood test from the IV stick.
Have you been drinking fluids? Have you eaten enough? Are your bowel movements normal? Is your urine a normal color? Are you on any medications?
I think it's my diabetes. I haven't been checking it.
Julie continues to struggle to breathe, so the PA takes a stethoscope and listens to Julie's chest and lungs. The PA hears crackling fluid sounds in Julie's lungs like boiling water. Using an oximeter, the medical team finds that Julie's oxygen intake is only at 88%.
Julie, it sounds like your kidney is failing. You're currently unable to filter fluids, which is causing your body to accumulate fluids, particularly in your lungs, which is essentially causing you to drown from the excess fluid.
I didn't realize my condition had gotten so out of hand. My legs have also been swollen. Would that have anything to do with it?
Yes, your legs are swollen due to the excess fluids in your body, which is causing pitting edema or lasting indentations. What we're going to do is start you on BiPAP and some medications that will help you relieve fluid from your body, all right? We'll see how your body responds and go from there.
The medical team puts Julie on BiPAP, Lasix, and puts a nitroglycerin paste sticker on her chest, and a diuretic through her IV that increases urine production, which will allow the excessive fluids in Julie's body to start draining. The doctor comes in to tell Julie about her labs.
Hi, Julie. It looks like potassium levels are concerningly high, which elects you for dialysis treatment. Unfortunately, your blood test came back irregular too. The increased BUN to creatine ratio signifies kidney failure.
So, what does that mean? What's next?
What we're looking to do is get you stabilized with this first round of medications. Once you're stabilized, we're going to get you transferred to the step-down facility where you'll receive your dialysis treatment. But before dialysis, we're going to arrange a quick surgery to get your portacath done so you can receive the treatment. That means we're also going to wait for a surgical consult. But for now, we're going to watch your fluid intake and outtake for a while to see how you respond. Does that all make sense?
Yes, it does. Is there any way someone can contact my partner? She doesn't know I'm in the hospital.
We'll get on that right away. I'll keep you updated on what we hear. I'm also going to head over to speak to the nephrologist about your dialysis treatment.
Julie's been transported to the step-down facility and has been set up to receive dialysis at her bedside. In the step-down facility, the nephrologist works with Julie to set up long-term care and refers her to a dialysis center. Julie and her wife continue to educate themselves on dialysis and what treatment for Julie will look like moving forward. Steve has been dropped off anonymously by witnesses at the front lobby entrance. Security guards at the ER entrance notice Steve is bleeding out and is losing consciousness. Security guards notify the ER clerk nurses, which immediately alerts staff to call Trauma Code Victor. As they enter the ER, the police are called, along with the trauma team, which includes the anesthesiologist, the trauma surgeon, 3 trauma nurses, the ER team, X-ray team, and the trauma residents. They all quickly mobilize and surround Steve. They carefully roll Steve onto a stretcher. As they rush to the trauma bay, Steve undergoes assessment for his wounds. He immediately receives an IV and his clothes are cut off by the nurses. In checking the ABCs of trauma, Steve is found to have 4 gunshot wounds to the chest. He is unstable and losing consciousness. Steve is put under anesthesia and intubated to prepare for surgery in the OR. In the bedside scan, the doctors find blood in Steve's stomach and lungs. Therefore, Steve's blood type is confirmed for a blood transfusion. The medical team hurries to the OR for surgery on the 2nd floor using the elevator. Steve is in critical condition and is near death. He is losing blood at a rapid pace. Assembling in the OR is a team of surgeons, a circulating nurse, residents, techs, a nephrologist, spine attending, and an anesthesiologist to treat Steve and his wounds as best they can. This includes a blood transfusion through his existing IV. After the operation, Steve is transferred to the surgical ICU where he is monitored by the trauma surgical nurses. He receives pain medication through his IV. After a week, he is stable. However, Steve's incident has left him paraplegic. The neurologist comes in for consultation on his condition. Steve also talks to a hospital casework manager to determine where he can go for rehab based on his insurance and his at-home care after rehab. The nurses give Steve his paperwork and he is discharged from the SICU. Steve is transported to a private skilled nursing facility outside of the hospital where he receives physical and occupational therapy. He remains in the skilled nursing facility for another 3 weeks before being discharged. Steve is referred to an at-home nursing care facility and then he goes home.